Good afternoon, and welcome to our press conference that we're holding virtually again from the third floor of the Waco City Hall conference room. I'm Larry Holsey, Director of Municipal Information and Communication for the City of Waco, and I'll be your moderator for this press conference again. Today, I'd like to let you know how we're going to handle this. First of all, we're providing social distancing for the 4 people that are in this room. We're also providing American Sign Language interpretation from our studio downstairs. And also, we're recording a complete separate audio track in Spanish. And we will replay the entire press conference, all the information provided by the 3 gentlemen that you'll meet in a moment, in Spanish today at 4:30 on our channel. So we encourage all people of all ethnicities and everything to watch and get the information that's going to go on today. And here again to help us with that, make sure our Spanish speakers are invited correctly. Councilmember Hector Sabito is here and will make that information known to our Spanish speakers. Councilman Sabito.
Thank you so much, Larry, for the time. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco, aproximadamente a las 4:30 de la tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Larry, thank you again so much.
Thank you, Councilman Sabito. Always appreciate your time and jumping in on these and all the work you do on the City Council as well. We appreciate that. Give you an outline how we're going to handle the press conference, much like we've done before. We have 3 gentlemen with us today. One is what's a little bit different from what we've had before. We have Dr. Mike Harden joining us in place of Dr. Griggs. Dr. Harden is a colleague of Dr. Griggs. He's the Director of Family Medicine Residency Program at the Family Health Center. Dr. Harden, we're glad to have you here. Also joining us is Judge Scott Felton from Mclennan County. And then our mayor, Kyle Deaver. What we'll do is we'll start off with opening comments from our mayor, then the judge, and then Dr. Harden. And then we'll take the questions. I'll read the questions that we've gathered through the last several days that have been presented to me and through the media. And then following that, we will open it for we have 2 media representatives on the phone. And the mayor will ask those questions to those reporters to speak their questions. So let's get started. Mayor, I'll let you start off with opening comments.
Thank you, Larry. Thank you to everyone who's joining us today. I want to thank Judge Felton for joining us again today, and Dr. Harden, thank you for sitting in with us. Sure. For all of you that have been doing the right thing and personally in your business and social life to help protect us from coronavirus in Waco and Mclennan County, I want to again extend my thanks. Many of you have done a great job of keeping us safe, and our curve has been flat up until now. That is changing though, and the data clearly shows that we are losing the advantage that we have built here in Mclennan County and Waco over the last several months. I'd like to show you a few slides. Whoops. Julie, it's not letting me share my screen. Can you correct that? Should let me share it now. Let's try one more time. Sorry about this, folks. It says it's failing to start. I'll tell you what. Let me ask Judge Felton and Dr. Harden to make their comments, and we'll see if we can get this fixed. Judge Felton?
Okay, thank you, Kyle. And generally, I make my opening comments after listening to you and getting some good pointers. But you know, as we have thought all along, that with the increased activity in our community, that the chance of more of the virus spread is possible. Even though, and I do want to compliment many entities, as the mayor was saying, about how they have really put a lot of thought into trying to keep their patrons safe, or the other members of their family and other community folks safe as well. And it gets back to rules are made to be able to protect people. People make the choice of whether they want to follow the rules or not. All that's fine and good until it affects someone else, and that's kind of the issue I think that we have right now. But I know I still think that efforts put out by these entities and the ones that are still putting out efforts to be able to keep their venues or their whatever events they're hosting safe is will pay off in dividends. I know here at the county we have working with the Office of Court Administration, that is the state oversight for the judicial process that actually answers to the Texas State Supreme Court, to allow us to, once our plan is approved, to start the judicial process back again, which has been disrupted for some time now, which can cause a lot of problems as well, as you can imagine, by not having the judicial process moving every day and keeping up with the both civil and criminal issues that pop up. We did get approval just about an hour ago. I got a message that Office of Court Administration did approve our plan that was written up by Judge Strother with the help of others in the court. So you know, we have the rules. We probably have a little bit more control about people coming in and out of the courthouse and what they need to follow than they would going to a restaurant or other places. But I just know the involvement I've had in it, how challenging it is. I look forward to actually learning from the press conference today on the information to be brought forward. So, Dr. Harding, if you'd like to.
Sure. Thanks, Judge Felton. Thanks, Mayor Deaver. First, I'll give a brief update on local statistics, and then I'll add a little commentary about those statistics as we go. So yesterday, unfortunately, we had 18 new cases that were reported yesterday, and unfortunately, I'm reporting now that we have 26 new cases today. That brings our total of cases to 222. 86 of those cases are active. 132 have recovered, and there have been 4 deaths total, so there are no new deaths. There are 335 people who are in active monitoring by the health department and health district. And those are people who have been positive for the disease or who have had contact and are in quarantine but don't have symptoms, and they're being monitored at this time. Here, we have done 12,519 tests. We have tested 6% of our population in Mclennan County. That is ahead of the Texas rate. The Texas rate is about 4.4% overall population. There are 9 patients hospitalized at this time with COVID-19. That's an increase of 6 from last week. 4 of those patients are Mclennan County residents. 4 of those hospitalized are in critical care at this time. As I mentioned, there have been no new deaths, 4 deaths total to date, and it's been some time since we've had a reported death. The recent cases that have occurred are in the community or among family clusters, as would be expected in a family. There have not been any hotspots. There have not been any spreading events. There's nothing that has broken out in group living situations at this point. This has been community spread. So in summary, unfortunately, our new cases are rising and have risen significantly on the report today, and our hospitalization rate is rising. So the commentary on that is, should I be concerned about this? Yes, you should be concerned about this, but this is not a reason to panic at all. But it is concerning. The perspective on this, as Mayor Deaver mentioned at the beginning, is that when we started this outbreak, our initial transmission was actually from cases coming in from outside, in from travel. We had a very low incidence, and our test positive rate dropped from 8% down to 0.5%. With the stay-at-home order that we put in place early, with the aggressive measures in the county here, we squashed the curve, as we said, especially compared to Texas. Texas started at 12% on their test positive rate and dropped only down to 4%. We made it all the way down to 0.5%. But unfortunately, with our recent rise in cases, we're almost on par with Texas as a whole right now. Our positive test average is 5% here in Mclennan County, and in Texas it's 6%. So we have seen our curve go up fairly significantly. That's about a 10-fold rise from the lowest point that we were in the past. So that is significant. It is true that we are testing more people than ever. We have at least tripled and sometimes quadrupled our testing here in the county. But as we test more people, we would expect to see that test positive rate go down, not go up. So the fact that that rate is going up in the face of increased cases is concerning. And these results indicate that we're having community spread at this time, not really hotspots that are causing this. So, but the good news on the other side of this is our local hospitals have significant capacity to care for these cases. They've planned well ahead. They've made contingency plans, and things are ready for cases. The majority of these new cases over the past week have been people under the age of 50. So they tend to be lower risk people, which means lower hospitalization rate, lower death rate. But unfortunately, young people are very mobile as well, and they tend to spread things a lot faster too. And this can spill over to vulnerable populations. So that is something that we worry about. And we also have an incredible capacity to do our case investigations, our contact tracing, and daily surveillance. We are following all of these cases at this time. We have not taxed the capacity of the health department, and they have contingency plans to have even more people available for that. They've done tremendous planning. So the most important points I would say is really these last 3 months leading up to now have been a practice run for what we really need to do at this point. Now more than ever, we need to physically distance, need to wash our hands, avoid touching your face, cover your mouth when you're coughing or sneezing, disinfect shared surfaces, and importantly, when you are out in public or can't physically distance, wear a mask. The mask is not about you, the mask protects other people. Very important to do that. We feel that we can, if we follow these guidelines, if we test all the suspected cases, if we isolate the people who are positive, and we trace contacts and effectively quarantine, we feel that we can control this at this point. But this is a team effort. We all have to work together. We're on the same team, and we have to all play by the same playbook for this thing to work together. So those would be my comments at this point. I'm glad to answer questions later.
Okay. Great points, Dr. Harden. Thank you for sharing all of that. And I think, you pointed out a difference in where we are now than when we were earlier when we had the first outbreak, is that our hospitals have now had time to prepare and build out additional ICU beds. And so that is not as great a concern as it was, but it could still reach capacity. And so we've got to work on this together. Julie, do you have those slides now?
Yes, let me share my screen.
Great, thank you. So all of these slides were prepared before we received today's number of 26 new cases today. So this is all through yesterday that these slides were referencing. Let's see if we can get these up now. If not, we can save them for the closing comments. Here we go. Appreciate your patience. All right, here we go. So this first slide is the slide that we show every week. And you can see that up until this last week, we were fairly flat on our curve. Now you see it steepening considerably. And again, that's before we add the 26 cases that were added today. Julie, next slide, please. This is our hospitalization. The highest that we ever got back in April was 8 cases hospitalized. That's where we were yesterday, was 8. We're now at 9. We never got above 5 in critical condition earlier. Now we have 6 in critical condition. So this is a significant matter, but taking into account what we talked about earlier, which is that the hospitals do have more capacity now to care for the COVID patients. Next slide, please. Okay, this is the Texas positivity rate. Again, this is total positive test results over test administered. and it had gotten as high as nearly 12% in April. It came down and was in the 6% range when we started reopening Texas. It continued to decline until the end of May, and now you're seeing that it has gone up and then plateaued again at about 7%. Now let's look at what's happened in Mclennan County. Next slide, please. So as Dr. Harden mentioned earlier, we had gotten down our positivity rate down to below 0.5% for a large part of the end of April and early part of May. Now you can see it shooting up at the end of the curve there, or at the side of the graph, and we're up at 3.5%. And with today's new cases, I think we'll probably be heading towards 5% very quickly. So that is a big concern, because we've had a very low prevalence of COVID in our county according to the positivity rate. That's changing rapidly now. And so all of this indicates we've got to do a better job of following the guidelines. Next slide, please. This is another significant slide. This is the active cases. That is the cases that have tested positive, less those that have recovered and those that have died. We never got above 40 active cases at one time. As of yesterday, we were at 62, and as of today, we are now in the 80s. So that is a very, very significant and concerning slide. Next slide, please. This is also an important number. These are the close contacts of those who have tested positive that are being actively monitored by our health district. You can see that number got down as low as like 25 at one point, and now it was over 272 yesterday and over 300 today. We have 70 caseworkers who are capable of doing contact tracing and monitoring. Each of those people can monitor 10 cases a day. So, last week I would have said that 700 cases, we probably wouldn't get there anytime soon. But the way that we are running up is alarming. And so we have contingency plans for how to deal with adding more contact tracers and monitors. Hopefully we won't have to get into those contingency plans. Next slide, please. All right, this is an interesting and very concerning issue, is that we have seen a rapid increase recently in Hispanic cases as a percentage of the population. Early on in March, most of the cases were white. If you take and compare population with the number of cases, they were more predominantly white. As the months have progressed, the white percentage has lowered and the Black and Hispanic percentages have increased. And now the Hispanic population that is testing positive is really rising rapidly. So we're concerned about that. We're talking about that, trying to understand what's happening there culturally, or from a workplace standpoint or living condition standpoint that we may be able to address, and also how we can more effectively get the message out in a way that is culturally correct and meaningful to that population. One more slide, please. This shows where we are now, that incidents per 100,000, you can see how much higher that it is for Hispanic and Black than it is for white at this point. So we've got to continue to keep an eye on that as we move forward. And that's all the slides, I believe, Julie. You can take those back down. One thing I want to say is that I'm receiving many emails a day asking for the judge and I to order wearing of face coverings or masks. The governor has made that basically impossible. He said that we can't issue any orders that are stricter than his or more lenient than his. So I think, every single time we have one of these press conferences, we all urge everyone to wear a mask or face covering when you're in public. That is one of the most important things that we can do to protect each other from the spread of this. The governor's taken away any local control for city and county government officials. But what we all possess is the ability to do this right and to follow the safety guidelines. So I hope we'll do that. And let's turn it over to Larry to take some questions.
Okay. Thank you, gentlemen. All right, the first question I have, with the most recent increases of new cases being confirmed daily, Are we entering a new wave of this pandemic, and should we react to and how should we react to the latest count news?
Dr. Harden, would you take that, please?
Sure. I think we are entering a new phase. The data looks like that, definitely. Phases about retrospectively sometimes, but the best information we have right now, this looks like we have active community spread that is going on, and those numbers are increasing quickly at this time, unfortunately. It is a cause for concern, but not for panic, as we mentioned. And what should we do? As Mayor Deaver said, legally, we have limited control over what we can do. But personally, you have all the control of what you can do. Personally, you can avoid going out when you don't need to go out. You can physically distance appropriately, wear a mask when you're out and can't physically distance appropriately. Cover your mouth, wash your hands, all of the things that we say all of the time. Very important to do. Decontaminate shared services. So if there's something you share with someone else frequently, decontaminate those services. If you go somewhere and you feel it's unsafe, I would leave. You really don't vote with your feet and leave. You don't have much of an option. Take care of yourself, but also work to protect others.
Okay.
Judge, anything to add to that? Sorry.
It's okay.
Well, I think to maybe a small extent, this press conference is helpful to get that information out, but also I think that the Waco Trib's done a good job, and news channels have done a good job covering this as well, but we have to be sure that, that information stays out there, and maybe some plan about public announcements or those things that we generate to be sure people are aware, first of all, of what the increases are, and then second of all, what can an individual do to not be part of the statistics. So that would be the only thing that we think about, is how we can expand the message for those people who really want to stay safe.
Okay, I want to have a garage sale on my property. Can I require people to wear face coverings?
Well, yes, you can. Just like any business owner can require that of someone that enters their store if they choose to do that. I would caution that maybe this isn't the best time to have a garage sale if you can put it off. But if you really have to have one in order to move or for some other reason, you certainly can require everyone to wear a mask, and I would encourage you to do that.
Okay. At the water park or spray pads, what parts of those kid-friendly facilities pose the highest risk?
Dr. Harden, can you speak to that?
Sure. So at any type of water facility, a pool, a water park, a spray pad, the water in and of itself is not the problem at all. The water in a lot of those places is treated or it's fresh, and so you're not going to transmit COVID-19 through the water. The problem comes when you have 50 kids all together in the water, sharing secretions and breathing on each other and passing it around. A month or two ago, I would have said, we're doing pretty good. I'm not as worried about it. With the increase in community incidents now, it makes the likelihood of passing something along greater at this point. So again, the only way to truly protect yourself is to remain physically distant or socially distant. That is hard with kids. It's hard in the summer. I have 3 teenagers. I understand how hard that is, but it is important not only for their health, but it's important for the health of everyone else.
The daily reports are showing an increase in the number of persons being monitored from 50 to 60, up to more than 335 today. Is this stressing the contact tracing staff?
Dr. Harden, can you address that?
Sure. I did speak today with the contact tracing staff specifically about this. Fortunately, the health department is extremely well prepared. Dr. Werner, Dr. Grave, Adahi Shaw, all of those involved with this have invested a lot of work in planning for this. They're able to investigate every single positive case and contact within 24 hours at this time, which is great. They're active monitoring everyone that they can. There are some cases they're unable to monitor because of people not giving sufficient info to follow them or contact them. They're worried they may have an undocumented status or some immigration issues, and that worries them a little bit. One of the important things about contact tracing is that if you are in contact with someone or you're positive, the health department will be calling you to talk with you. Giving them accurate information and full information is so important to helping us contain the spread of COVID-19 at this time. They have over 70 contact tracers at this time. They have room to expand with more if need be. So fortunately, we're in a very good situation locally for being able to do that service.
Okay. Mayor, this is a question you kind of referred to earlier about the various mayors. 9 mayors from cities around Texas have asked the governor for the authority to enforce wearing masks. Is that something you would consider doing?
That's a hard question, Larry. But if the governor were to allow cities and counties to order that, certainly a question that I would want to discuss with our council. I think even though it seems very personal to order people to wear masks, it's so much preferable than having to order us to back up in our economic opening. And that's what we've been saying for the last several weeks. If we can do this safely, we can proceed. And if we can't do it safely, then the governor's going to have to reconsider how he's moving forward. And we're going to have to consider talking to the governor about, giving us some exceptional control. I hope we don't get to that point. And that was a very painful thing for our community and everyone else in the state to go through. I think it did help us in the early stages. And so we just don't want to give up these gains that we've made so far with people's sacrifice to get us here. Judge, you have anything to add to that?
No, I'm glad it was the mayors, and the governor, than the county judges. But like you said, that would be something that we would get with our deliberative body to discuss and talk to many community members. And of course, the main, like you, I hope and pray that we don't get to that point of going there. I do see and if people want to participate in certain events or go to certain places that, if you want to do that, it's your choice. But if you do, you need to wear a mask to go in there. And so that could be one approach where it was, if you want to do this, then here's what the requirements are. But that's a hard thing when you start mandating how people dress and other things. But still, each of us affect others or could be infect others. So we would take that under consideration.
Okay. Earlier this week, I saw there are 41 or 54 ICU beds in use and 16 of 27 negative pressure rooms in use. Is this a concern for us?
Dr. Harden, can you speak to that?
Sure. No, it isn't a concern right now. Actually, all of those ICU cases are what would be typical. The majority of those are typical ICU cases that we would have at any time in the hospital. And so as people go back into the hospital again more, there was obviously a decrease in hospitalization for a while, which was kind of unexplained with the number of people going to the emergency room, fewer accidents with people driving, less infectious disease and illness. But as things open up, the routine illnesses like pneumonia and sepsis and the other things that we see are still in the hospital, still in the ICU. Each hospital has specifically reserved a certain number of capacity of rooms to be available to treat COVID patients, whether that's ICU or floor status, and to be able to successfully and appropriately isolate them in the hospital. So both hospitals are probably at the most 10% of that COVID capacity right now, have a long way to go until they would reach capacity.
Okay. In your statistics for today's report, you did not report any new deaths, so there are no new deaths have been announced. The question is, are there any deaths suspected to have been caused by COVID-19 being investigated right now?
I'm not aware of any. Are you, Dr. Harden?
No, there are none that I know of either.
Okay. Does the number of tests reported on the COVID Waco website reflect individuals who have been tested, or does it include multiple tests taken by the same person? And a follow-up to that, do we know how many people have had multiple tests?
Dr. Harden, do you have that information?
Yeah, good question. I can answer part of that, and I can say I don't know on the other part. So the first part of that is that some of the tests, not the results, but the tests may reflect duplicate tests at times. There are certain people that require duplicate tests and repeat testing, often healthcare providers in settings to make sure they can go back in, or anyone working in a nursing home right now. And there may be duplicate tests, but the new cases and the reports are not duplicated at all. Just testing, but not the new reports. And then the final part of that question was? on that, Larry?
How many?
Do we?
How many?
How many do people have been
Do we know how
multiple
many?
tests? Multiple tests.
And we do not know that. The data is not reported to be able to know that information. It's not reported at the local level, not reported at the county level, at the state level, at the national level, or at the international level. There is no agreed upon reporting. So unfortunately, we don't have that granular data at this time.
Okay.
So that testing data could affect slightly the positivity rate, but it would be such a small, it would be minuscule if we've had
Exactly.
multiple
Right.
tests. Definitely doesn't affect the new cases.
That's correct.
Okay, can the public health district determine how many people in Mclennan County are considered vulnerable because of their age or medical conditions?
Dr. Harden, I'll ask you to try to take that one as well.
Sure. Good question as well. U.S. Census data gives us some broad data about ages, and we can look at things like that. But unfortunately, there is no central registry of those people with chronic conditions. Our health system in the United States is not structured in a way to standardize and report that information on a community level. Individual health systems may be able to access that data with their health system. For instance, in the Family Health Center, I'm sure Ascension Province and Baylor Scott and White can run numbers and look at their patient populations as well in our clinic. And we have done that to look at our numbers to see who could be vulnerable and to watch those and to reach out to those patients. But as a community as a whole, we don't have those statistics.
Okay, this is kind of following the same kind of thing. Since there appear to be significant differences, especially in mortality, between older age groups and with persons with certain prior health conditions, why does the public sector not have the differentiated rules for those different groups of folks?
Judge Felton, would you mind speaking to that?
Well, we have differentiated guidelines for sure for those groups. And, there again, to make sure that we get those guidelines out to those folks is important. And I think most people of the older age group have picked up on that. I know in the conversations I have with people in the community that they seem to be the most aware, but there's still probably others out there that aren't. But there's no question about it. And the question previous that had asked about people with conditions, generally the older people are going to have some of those conditions. So the older they get, the more apt they're going to acquire diabetes type 2 or things like that would make them more vulnerable to that. So, and then there's a lot of guidelines around nursing homes and rehab facilities and things like that we're already implementing and show to be successful. So, I do think that we are focusing on people with those higher risk.
Yeah, Judge, and I would just add again, I mean, we don't have the ability to do that even if we wanted to, because the governor has removed that control. But I think it would be really hard for you to put different laws in place or different restrictions in place on a legal basis based on age and vulnerability. I think it would have some social impacts that would be undesirable at the very least.
It's education is what we can offer.
Okay, why can we have a parade this Saturday but no 4th of July celebration?
That's a good question, Larry. I'm sure people are confused about that. There are a couple of things that you need to know about that. Obviously, both of these events, Juneteenth and 4th of July, are important historical and cultural celebrations for our community and for our country. But the 4th of July celebration is put on by the city. And the city did not feel comfortable that we could safely conduct that event with tens of thousands of people gathering together down by the river to watch the fireworks and listen to live music. Additionally, there were contracting considerations there in terms of getting that determined early enough. The Juneteenth parade is not put on by the city. It is put on by the Greater Waco African American Chamber of Commerce. They are doing it in a way that they can keep all of the participants in the parade, those who are riding in a parade, safely distanced. We are televising it on WCCC.tv on Saturday morning so that people will hopefully stay home and watch it on TV rather than going to the parade. But if you do go to the parade, please do your best to stay physically distant from each other, wear face coverings, all the things we've been talking about. I think that the sheer numbers made the 4th of July thing completely unworkable. I think the Juneteenth parade probably can be held safely, but it's going to be up to everyone who is there to be sure that it is held safely.
Okay. I have a family member that needs to be moved into a nursing home. Who can help me with that decision and choosing a nursing home?
Dr. Harden, would you speak to that, please?
Sure. Choosing a nursing home and choosing to transition a family member into a nursing home is an extremely difficult decision, even in the best of times. It's even harder right now with COVID-19. Often I would counsel someone to ask friends and neighbors, ask for advice for people who have family members in nursing homes, to visit the nursing home personally, to actually get a feel for the nursing home, meet the staff, see the conditions. Unfortunately, that is off the table right now with nursing home restrictions. You're unable to do that. But there is also a website that CMS has where you can look online, federal data on nursing home safety and quality, and that information can give you a clue as well as to what a nursing home is like. Unfortunately, it's a more complicated decision right now. I think the best thing you can do is look at verified data online through CMS, ask friends and family who may have people in nursing homes and get recommendations. Unfortunately, visiting the nursing home is off the table right now.
Okay. What is the spike protein?
Dr. Harden, I'm definitely going to ask you to explain.
Come on, man.
All right. Well, this gets in the weeds a little bit. So the coronavirus, best we know at this time, has 4 proteins that are expressed on the outside of the virus. And one of those is called the spike protein. And the spike protein is kind of like a ball sticking off of that virus right there. And then your cells have cups on them, and that ball fits perfectly into that cup on one of your cells. And when that happens, that spike protein changes and this cup changes, and it allows that virus to inject its genetic material into your cells. Your cells begin to become a factory and make more virus genetic material and more virus particles and then spit them out. So a virus in and itself is not alive. It relies on your own cells to be able to reproduce. And that's what that spike protein is. And that's why you may have read for working on a vaccine, very, very important is to target this spike protein, because targeting that with the vaccine prevents it from blocks it from binding to your cells and infecting you at that point. So there are 2 preliminary vaccines that they're working on right now. One is a genetically modified one that is actually that protein itself, so you make antibodies against that protein. Another one is where they've changed an adenovirus or a common cold virus to express that same protein. It won't cause a cold, but giving you that virus through an injection immunization will expose you to that protein. You will make antibodies against it and prevent COVID infection in the future. So those are the strategies, but that's why the spike protein is targeted.
Interesting.
Speaking of vaccinations, what percentage of our population needs to be vaccinated in order for our country to be safe?
Dr. Harden, can you speak to that, please?
Sure. I'll be honest and tell you no one knows that answer yet because COVID-19 and SARS-CoV-2 virus are brand new illnesses. And we really only know over time what that number is. But to put it in perspective, we think anywhere from 40 to 70% of the population needs to be vaccinated to create what we call herd immunity. So herd immunity means enough people are immune to the infection where if a case gets in there, it does not spread quickly. It's like having a wildfire in dry grass, or a wildfire happening when it's raining and the grass is all wet. If you got herd immunity, it's all wet, it's not going to spread quickly. But if it's dry and no one's had that COVID before or not immune to it, it's going to spread like wildfire. In perspective, measles, you have to have a herd immunity of 90 to 95% to prevent the transmission of measles. So, because measles is so infectious. So it really depends on the disease itself. We're guessing. My guess is really more in the 60% range, 60 to 70, but anywhere from 40 to 70% have to be vaccinated. So that underscores the importance. That is the way we will eventually defeat this. When a valid vaccine is created and it's safely rolled out, it is going to be extremely important for the most people to get vaccinated who can be vaccinated. No one loves a shot, but it's extremely important.
Every one of these press conferences have always had a question regarding testing, so I'm going to ask it again. When should I be tested, and where can I go to be tested?
We'll see if Dr. Harden answers this differently from Dr. Griggs.
Uh-oh. And I didn't watch Dr. Griggs' press conference, so we'll see what I say. I'll confess it to Dr. Griggs. So anyone who has symptoms should be tested. If you think you may have COVID-19, you should be tested. So symptoms can be anything from obviously fever and body aches, fatigue, cough, runny nose, sore throat, a new loss of your sense of smell or sense of taste. Sometimes diarrhea or nausea or vomiting are part of that well, but if you don't feel well and don't feel right during this time, you know, there's not much else circulating out there. There's some colds and other viruses around. Flu is not circulating heavily right now. If you feel bad, if you feel sick or have any symptoms, you should be tested. To get tested, the most important thing is to call your physician. They need to know in advance, your healthcare provider needs to know in advance that you're coming in for testing. Every site has a protocol on how to do that safely to keep people who potentially have COVID out of the waiting room and to keep from infecting other people. If you don't have a doctor at this time, call anyway. The Family Health Center will work to get any new patient in. If they call by 2 o'clock the same day, get them in for testing. I know the other healthcare providers, Baylor, Scott, White, and Ascension Providence as well, have protocols in place. Please call, come in, get tested. We urge you not to go to the emergency room just for testing, unless obviously you're significantly ill. If you're short of breath, having difficulty breathing, you know something's not right, immediately go to the emergency room for testing. If it's after hours and you wake up at 3 in the morning and you're just not feeling right, if it can wait till the next morning, you get tested during the day, that's great. If you need to go to the emergency room, obviously go there to get tested.
Okay, but if it's worth getting tested, is it worth getting tested if there's nothing we can do to stop it?
Dr. Harden, please speak to that.
It is absolutely 100% worth it to get tested. And here's why. The only way to control this infection now that it's out there in the community is to test everyone who has symptoms. And if they are positive, isolate them from other people at this point appropriately until they recover, and then contact everyone who's been in contact with that person and trace all of those contacts and then appropriately quarantine them as well to observe them for illness. Sometimes they're tested, sometimes they're not. It depends on the case and how at risk they are. But testing is absolutely critical to control the pandemic at this time.
Well, but this is one that's just kind of right in that line. Wouldn't it just be better if we all got the virus and just got it over with?
Well, some countries are trying that approach, right, Dr. Harden?
Yeah, I'm sure a lot of people have heard this out there. And those of us who are old enough remember chickenpox parties when we were younger, just try to spread chickenpox to our kids so they wouldn't get it when they were older, because it was bad to get it when you were older. The answer to this is no. And the reason is this is a brand new illness. No one, the vast majority of people have no immunity to this illness whatsoever. If you get the flu one season, you probably had the flu in the past, you have some immunity to it already. Older adults had immunity to chickenpox. It was fine for their kids to get chickenpox. But in this case, you get this illness. The death rate, unfortunately, for this illness is much higher than it is for influenza. And so it's certainly much more deadly. And of course, the other risk is so many people get this illness and are severely ill that it overwhelms the capacity of the hospitals. And when you overwhelm the capacity of the hospital, people needlessly die at that point because you're unable to provide them the care that they need. You don't have sufficient ventilators, sufficient oxygen, or sufficient personnel to take care of them. So it's absolutely imperative to slow the spread of this disease until we get a valid vaccine that works or a treatment that effectively works for this.
Mayor, this question probably was addressed on your earlier statement with your graph that you said, but what is the demographic breakdown of positive cases?
Yeah, I did address that in the opening statement, and we do have a situation now where I don't have the exact percentages in front of me now. I did earlier, but we do have a situation now where on a per capita basis, Hispanics are considerably experiencing this disease at a higher rate. higher than blacks and blacks higher than whites. And so it's definitely a situation we need to continue to examine here in McLennan County to see what accounts for that. And that work is ongoing. We do continue to monitor how we are conducting the tests, and the tests so far have been conducted in a way that both blacks and Hispanics are tested slightly higher per capita than whites are. But it's always been within 2 or 3 percentage points of the actual population breakdown. So that's a good thing. We've monitored that from the beginning to be sure that all races and ethnicities had access to the testing. And it appears that continues to be the case. But now Hispanics are testing considerably higher than blacks, who are testing considerably higher than whites positive for COVID-19.
Okay. Will the increase in cases cause another shutdown?
Judge, would you speak to that, please?
Thanks a lot. Well, another shutdown would probably draw a significant amount of pushback from the community. There would have to be, we'd have to be in a very severe situation with all of our hospitals full and ICUs. Losing capacity, and that seems to be a long way off, fortunately. And we've on an earlier call today, the hospitals felt comfortable that they've got a lot of room, and there's other measures they can take. Also, we're fortunate to have 2 hospitals that are in large systems that have those systems to support them as well. In there, as we found out, there's a lot of unintended consequences that come from a shutdown. So, hoping and praying that we don't get to that spot. So, did I successfully dodge that question?
Well, I agree. That's about the only answer you can give at this point. None of us would want that, and the way to avoid that is to follow safe practices.
Right, exactly.
The next question, you think you've already addressed it, but why are masks not mandatory? I think you've already pretty well covered that, unless you had anything else.
Well, while we've been in this press conference, the governor has given a new clarification that while judges and mayors can't order people to wear face masks, the local government can order businesses to require face masks in order to enter them. So that's a whole new conversation that Judge Felton and I will have to have with our commissioners and city council members respectively, and talk about that aspect as a possible safety measure.
Okay. Glad I asked the question anyway.
Right.
People are not taking social distancing seriously. How do we enforce this?
It's not really a matter of us being able to enforce. We've got to, as Judge Felton says, every press conference, we've got to educate and hope that people will respect each other enough to do the right things, to keep each other. I mean, that's why we live in a society. We are responsible to one another, and it's so important that we do this. And I hope our community, as I said in the beginning, many people in our community have taken this seriously and done all the right things. We've got to try to bring the rest of the party around. Judge, you have anything to add to that?
Well, no, I mean, people, like you say, make choices. People get stir crazy, whatever you want to call it, that bored and want to do things and be involved in things. So just be very selective about those. There's a lot of activities that are outside where it seems to be much safer in outside environments and those things. So just try to choose wisely and activities you want to be involved in.
This one deals a little with the fear factor, but I think it's on the minds and hearts of a lot of people. With the increase in cases, I'm more frightened now than in March. What can we do to stop this?
Well, it's a lot of what we've been talking about, but Dr. Harden, if you could add anything there, that would be great.
Sure. Fear's a valid emotion. I think all of us probably on this conference have felt a range of emotions about this, from, oh, this is probably no big deal, to, oh my gosh, this is horrible, to, oh, this is irritating me and bothering me, to, oh, I'm tired of wearing a mask, it's tired of socially distancing. And, I think concern is appropriate about this. Obviously, if it's fear to a point where that's impacting your ability to function appropriately in life, from being able to sleep at night, to be able to have appropriate interactions with your loved ones, to be able to do your work if you're working from home in another place. That's a different story. We certainly know that during a pandemic like this, when there's a lot of stress, when there's a huge amount of change and a huge amount of societal change, not just the pandemic, a lot is going on at this time, that really weighs heavily on mental health for a lot of people. If you're feeling and if you're struggling with that in any way, you should definitely contact your healthcare provider, a mental health provider, a counselor, a pastor, someone that you can talk with and discuss those things. There is no substitute for being able to talk to someone. There is no substitute for getting some type of aerobic exercise, whether it's going out and going for a walk, getting some sunshine, getting a good night's sleep, prayer, meditation. All of those things are very effective for mental health. So I think fear is a very valid emotion. Your response to fear is honestly, you should turn that into action. And your action should be what you do personally, as we've mentioned multiple times here. We have a clear playbook as to what needs to be done to help manage this pandemic. Do your part, and I think you can feel comfortable that you're doing your part. It's hard not to be frustrated about what other people are doing, but really you're responsible for your own behavior. That's the key thing.
Okay. There have been positive cases in daycares. How do I protect my children?
Dr. Harden, can you speak to how you protect your children?
Sure. That's a great question. And I'm going to tell you, I don't know how you protect your kids in a daycare or a group setting. They have protocols in place to sanitize things, to keep a limited number of kids in certain areas. But you and I both know if you've had kids, it's hard to keep kids separate. And they're going to share things and they're going to share germs. And that's just the way they are. If you're someone who is at higher risk and your kid needs to be in daycare, that raises a very difficult situation, because obviously being in a daycare situation raises a risk of contracting something and then passing it to you. I think that the only advice I can give you is that maintaining physical distance as much as you can and appropriately is the thing that decreases the risk the most. Obviously, if you need to work and your kids need to be in daycare, take a look at the daycare, make sure they're following the rules. The rules are clearly, or the recommendations are clearly posted on the governor's website in Reopening Texas, to look for the recommendations for how a daycare should operate. Make sure they're following those things. If they're not, really stick it to them. I mean, you're paying the money for that daycare. So make sure they're following those recommendations.
Okay, hospitals in Houston are full. What will happen in our local hospitals when they became full with COVID-19 patients?
Judge Felton, if you could answer this, I think we'll make this the last question until we turn to
Okay.
I kind of answered it earlier. I've answered it in a couple different ways, but the only thing that I would add is that, we are getting enough data now that we can start trying to be a little bit more predictive, and with the help of the local hospital leadership, help us kind of predict where we might be in the future if the trends stay the way they are. So, and then the knowledge that they have in regards to how a virus reacts in the fall of the year and those kind of things. And so we'll try to, be real close to that and understand it. But I think we're, a long way from what, from that scare right now. But we will keep an eye on it.
Thank you, Judge. At this point, I will take a couple of questions from each of the media representatives that are on the call. Drake Lawson at KWTX, you have a question?
Yes, sir, I did. Mayor, can everybody hear me okay?
We can.
Yes.
Okay, perfect. I just wanted to double check on that. So I was going to circle back to something you guys had mentioned earlier in the press conference. I know that you talked about the fact that if these numbers continue, it might be time to re-examine the reopening process and talking to the governor again. What point do you guys do that? At what point does it become time to look at the restrictions and possibly putting those restrictions back into place?
Well, I'll start. Judge Felton probably has some thoughts on this too. So I think it's a host of things. I think you have to look at that positivity rate and see when it starts getting dramatically higher. When the governor originally began talking about it, he said he would become very concerned if the states number got above 10%, I would certainly be concerned if ours got close to that. The other main thing that we're watching, though, is hospital capacity, and that's what I would be very concerned about as we start to reach that capacity, which is, Dr. Harden pointed out, we're nowhere near that at this point, but we don't want to get close to that either. So, Judge, any additional thoughts?
Well, nothing other than, as you know, last week I was contacted by Texas Department of Emergency Management Chief Kidd, who reports directly to the governor, and where if we have issues or hot spots, that they would come in and help us with those. Of course, you know, the Guard has come in to help do additional testing, but you know, I think that they want to pull all the stops to be able to control it and help locals, give them feedback, and then they send us whatever support we need to isolate that. So rather than thinking about putting on more rules, is really putting on more strategic plans to find out where the hot spots are and deal with them so they don't get out of hand.
Dr. Hart, any additional thoughts on that?
No, I would agree. Test positivity rate and then watching our hospital utilization. The best number we have is hospital utilization or deaths. Unfortunately, deaths is something we don't want to see, and that lags a week or two behind hospitalization as well. Put in perspective, at the beginning of the pandemic, when it was an outbreak in New York City, test positivity rate was over 50% at that time. Wow. It was an outrageously high number. So 10%, I agree, would be something to be worried about and concerned that we're on the wrong track.
Thank you. Thank you. Rhiannon Sagert from Waco Trib, are you online?
Yes, hello. In January, February, and March, Texas saw more deaths than usual, and there's a chance that early cases of COVID-19 were undercounted. Did Mclennan County also see more deaths during those months than usual? And do we think that cases have been undercounted here?
I don't have any information about that. Dr. Harden, do you?
I don't have any information on that either. We don't think so, but I can't answer that definitively.
Okay. We have another caller on the line, and I understand it may be State Representative Doc Anderson. Doc, are you on the call?
Yes, Mayor, this is Doc Anderson. I appreciate that opportunity, and y'all are doing a great job there. The one thing I might add, Dr. Zerwas from the state level announced yesterday that there was 15,000 beds available if there was an increase, and that the ICU beds were actually a little over 1,600 ICU beds available. So they had a surge capacity across the board in beds and in excess of 6,000 ventilators. So it's a situation that definitely requires monitoring, but that the state does have those capabilities, and the governor will be using that as a criteria. I just kind of wanted to add that. I appreciate it.
Thank you, Doc. Appreciate you calling in. And I think that is, again, as we talked about earlier, that's a significant difference from where we were back in March. We've got all these contingency plans in place now, and we are in a much better place to handle a surge, and probably are going to have repeated surges the way this thing is looking at this point. Drake at KWTX, do you have another question?
Yes, sir. We did have one other question for you regarding businesses. Businesses in the area, if they do have an employee test positive, is there a process or is there something they are required to do with the county?
There is a process for that. Dr. Harden, are you comfortable with explaining that?
Sure. I think I can explain that. I may not know every bit of detail of that because someone else is responsible for that, but yes, absolutely. That case will be reported immediately to the health department. The health department will then do the appropriate management and investigation of that. So the health department will reach out to you for that, definitely. Obviously, if you have a worker that is testing positive, that worker should obviously be off of work and be on isolation at that point. At that point, the health department will come in and appropriately investigate, do contact tracing at that point, and give you very clear advice and recommendations as to what you should do as the health department. You can also, obviously, if you have a case that turned positive in your place of business, reach out to the health department as well, proactively, and they can give you immediate advice while they're pending their investigation as to what to do as a business. But it is very important as a business to take appropriate steps after you have a positive among your employees.
Great point. Thank you, Dr. Harden. Rhiannon, did you have any other questions?
Yes, in May, 2 meat processing plant workers tested positive for COVID. Have more meat packing plant workers tested positive, and is there a concentration there?
We have had one plant here in town that has just finished conducting plant-wide testing. And so that was a little over 1,100 workers that were tested. We don't have the results back for that. That work was completed, I believe, yesterday or today. It was 2 or 3 days of testing to get those people done. At this point, we don't think we have an outbreak, but obviously the results of that testing will tell us a lot more than we know right now as to whether there may be some asymptomatic persons in those plants or something like that. Mike or Dr. Harden or Judge, anything else you would add to that?
There was a high percentage tested as well, I think in the high 90s, which with people on vacations and those kind of things, that's understandable. So it should be a good indicator.
Yeah, I agree. Did incredible work getting in there, doing the testing. Some of the results are pending, but at this time, we know of no hot spot in a facility like that.
Okay.
Thank you.
I think we'll conclude our questions there. And I'll ask Dr. Harden if you'd like to say some closing remarks.
Sure. I think, my only closing remarks are to echo what I said earlier. The past 3 months have really been a warm-up for what we need to do now. We were in a great position. Things have changed right now. We have a playbook. We know what we need to be doing, but we all have to play by the same playbook for this to work appropriately. And that means we still need to maintain our physical distance, wear a mask to protect others, somewhat protect yourself, protect others when you're out, wash your hands, cover your coughs and sneezes, appropriately, don't touch your face, appropriately social distance, only go out when you need to. Those are the things that we know that work. If you have symptoms of COVID-19, if you have any suspicion that you may have it, please seek attention, medical attention, get tested, and then we can manage things appropriately at that point.
Judge Felton?
Thank you. Well, first of all, I'm really proud to work with Dr. Harden. He's done an excellent job. Dr. Harden's with the Family Medicine Residency Program. And although Jackson Griggs is a great spokesperson, well, now we have 2 from that area, 2 from that organization that are great spokesperson for the medical community and helping us break down a highly complicated and technical virus into something we can all understand. I continue to be impressed with Mayor Deaver's passion and being able to handle these hard situations in our community, which we have our share of them right now for sure. And I appreciate your leadership, Mayor, in that regard. I want to continue to encourage people to shop local. We still have people trying to get back on their feet. But also, as Dr. Harden mentioned earlier, if you go into a place that you don't feel comfortable in, then you can vote with your feet by walking out and going to a place that you do feel comfortable and feel safe in being there as well. Additionally, we've talked about the census. It's very important to this community. There's going to be federal and state funding that comes from the census count that we need to be sure that we're counted and we get our share of it, because it is something that's important economically back to our community and enables us to help the folks in our community much more if we have a higher count in that. I think, and correct me, Mayor, if I'm wrong, but I think website is yiCountWaco.org. Is that correct? And
yes, that is correct. And you can also just go to census2020.gov. There are several ways to get there, but it's pretty simple.
Good. Other than that, I'm hoping that this is just a kind of an aberration that's popped up on us here, and we'll start leveling back off, but we'll see within time. Thank you.
Thank you, Judge, and thank you for your remarks. Thank you again for your leadership of the county. Dr. Harden, thank you so much for joining us today. Great job, and we really appreciate it. It's so important for us to get this information out to our citizens and let them understand what's going on in our community. I know that every week it seems like we drone on and on and on about doing these things, keeping your social distance, washing your hands, covering your face when you're out. I know it gets old. It's now urgent that we do those things. If Judge's wish is going to come true, and this is just an aberration, the only way that's going to happen is for us to change our behavior and cover our faces, do all those things. And that's all part of taking care of yourself and taking care of one another. Please do that, and let's get this thing back under control.
Well, I want to thank all three of you, as always, for being so straightforward and being our leaders in this. And we couldn't have better leadership right now. And I thank you for that. And I thank everyone else for watching. Do what these three gentlemen have recommended, and that's the way we will beat this thing. It's all up to us individually to do that. Thank you for joining us, and have a good day.